Hi guys, feeling a little bit better today. I want to talk about something really important that I learned today and something that I got to go through. And that is the connection between dissociative identity disorder and the vagus nerve. Now, the vagus nerve is a nerve that runs from the back of your head all the way down to your butt. Okay? And over the years, if you are under a lot of stress and trauma, it can mess with everything. And I'm going to give you vagus nerve problem symptoms here. Vagus nerve conditions cause different symptoms depending on the specific cause and what's affected part of your nerve. You may experience abdominal pain, bloating, acid reflux, gastrointestinal issues, changes in your heart rate, blood pressure, or blood sugar, difficulty swallowing or loss of gag reflex, dizziness and fainting, harshness, wheezing or loss of voice, loss of appetite, feeling full quickly or unexplained weight loss, nausea and vomiting. And this can lead to, over the years, more and more problems, which is kind of what I'm dealing with. How are vagus nerve disorders diagnosed? Your healthcare provider may order one of these tests to diagnose the problem with your vagal nerve. CT scan or MRI to look for intestinal blockages, which I have dealt with for years. A echocardiogram to assess heart function. Gastric emptying solid study, which is a smart pill, which is like this little pill you swallow and electronically shows where your food goes and then it comes out, which I've never had done, but I'm thinking on it. An upper endoscopy to examine your upper digestive system. These are things that are going to point out, okay, there's a problem. Okay, what is the function of the vagus nerve? Your vagus nerves are part of your body's nervous system. They play an important role in involuntary sensory and motor movement functions, including digestion, heart rate, blood pressure and respiration, breathing, immune system responses, mood, mucus and saliva production, skin and muscle sensations, speech, taste, and urine, and the other end output. There's a little bit more on the communication of the vagus nerve and what it does. The vagus nerve is a communication superhighway that runs from your brain to your bowel, and the messages it sends up and down between the two have a significant impact on your IBS symptoms. It's the chemical communication that runs along this gut/brain axis that can make you feel sick with worry, have butterflies when you're excited. Sometimes miscommunications can happen along the vagus nerve. The wrong messages are sent, or the right messages are misinterpreted for people with IBS. This can lead to gut symptoms such as diarrhea, constipation, and severe pain. That sounds familiar. Studies have shown that IBS is not a gastrointestinal illness. Instead, it is a complex disorder involving the way your brain and gut interact with each other. Now keep in mind with DID, it's fluctuating back and forth, and there's all this stuff going on. It was just going to cause a lot of issues. Hence the fight-to-flight response. The other two subsystems of the autonomic nervous system are the sympathetic and parasympathetic. These play a key role in your stress response and can influence your IBS symptoms. When you're feeling stressed, your brain kicks your sympathetic nervous system into gear. Messages fly along your HPA axis to your gut, communicating that your body needs more adrenaline and less digestion. Instead of processing food, your body needs to flee or flight, which is something we're stuck in all the time. Your body will respond by either slowing digestion, causing constipation, or speed up to cause diarrhea. When there's no danger, you're not feeling stress, and all is quiet along the HPA axis, this means your vagus nerve has sprung into action and your parasympathetic nervous system is engaged. Your heart rate will slow, you'll feel more relaxed, and your digestion will be stimulated. This is commonly referred to as rest and digest setting. with people with DID, we don't do that too often because we're always in that hypervigilant mode. These IBS-related anxieties that set off your fight-to-flight response are very common, and you're not alone. Excuse me. For many people, it can feel like your symptoms and stress go hand in hand, and studies have shown that DID, BPD, schizophrenia, and any generalized anxiety disorder is 5 times more common for these people to have IBS issues. Go figure. This type of stress also actively creates oversensitivity in your intestines, leading to pain and discomfort and maybe even bleeding. When your gut experiences this kind of increased sensitivity, it once again sends distress signals to your brain. So they're both messing with each other. Now on to something else. I want to play this video for you. It's called Dissociation from the Body and the Vagus Nerve. And this is on YouTube. So listen closely.
Following chronic and traumatic stress, interoceptive awareness can change, and this can lead to nervous system dysregulation. So then, on one end of the spectrum, you may become hyposensitive to sensations, and on the other end of the spectrum, you may become hypersensitive to sensations. So with hyposensitivity, you may dissociate from the body or parts of the body. So you numb yourself from that physical pain or emotions. And short term, this helps to get through periods of adversity, because when you numb yourself from the pain, you can get through it. But long term, it dampens down the bidirectional communication between the body and brain that happens via the vagus nerve. So with the vagus nerve, 80% of its fibers are sensory, which means it's carrying information from the organs like the gut and the heart up to the brain. The brain takes in this information, and then it influences how the 20% of those fibers come back down into the body. So that will change the beats of our heart, our breathing rate, and also our digestion. Long term, with a dissociation from the body or being hyposensitive to sensations, it can change the way these feedback loops work. And this can lead to things like certain arrhythmias, it can lead to gut disorders like IBS, and it also may result in chronic fatigue.
So I thought that was really interesting. I have a lot more to learn because this is all new to me. So I guess the question is, does anybody else have vagus nerve issues, and are they similar to this, and what do you take? I am on dicyclamine right now to numb my colon to help me go, but I'm still dealing with the stress of the digestive part of the issue. So what happens is I'll either not go for a while, or if I push too hard, I pull a nerve. So I guess I'm kind of curious to see you guys' input, and I hope you look into this and, let me know your thoughts. Love you guys. Bye.